Hi everyone, I'm Dr. David Bernstein and I wanted to welcome you back to our series 25 Tips for Working with Modes. Okay, last time we learned how to recognize modes and we learned that it's in the details. And today we're going to learn how to talk about modes, and in particular, how do you talk to patients about their modes? So it actually turns out to be quite simple. We use a particular phrase like a side of you or a part of you. And so let's say, for example, you're in a therapy session and you observe a particular mode, right? Because it always starts with observation. There's a mode that's present in the session with you, and you wanted to draw the patient's attention to it. So all you have to do is use this phrase, I see a side of you that, and then simply describe what you see. So it might go something like this. Hey, I see a side of you right now that, when you're talking today, just seems a little bit removed from your feelings, maybe a little bit, distant, a little detached. And that's it, okay? All you're doing is using this phrase, I see a side of you that, and then simply describing what you see. Okay, it's that simple. Now, why do we do this? Why do we use this language of a side of you or a part of you? Because maybe it seems a little bit awkward or artificial. Well, it really has some advantages. The first is that it draws the patient's attention to the mode that he or she is in. Okay, remember that modes, when they're active, dominate a person's experience, right? They dominate how somebody thinks and feels and how they cope and even perceive things in the present moment. And so just by using that phrase, I see a side of you, it just sort of brings that mode to the patient's awareness. All of a sudden you're kind of looking at the patient's mode together with him or together with her. And the second thing is that it's a less judgmental way of referring to somebody's modes. Sometimes modes can be difficult. They can be difficult for us. Like think about a patient who's, detached most of the time. And you want to get to what's underneath it, but the patient makes it hard for you. So this is a way of approaching the patient about this side without rejecting him for it. Because you're not saying something like, hey, I see that you're detached right now. That could come across as, maybe a little harsh, or a little, little judgmental. Instead, you're saying, it's just a side of you, right? And I know that that side is there for a reason, right? Like in the case of this mode, the detached protector mode, we know that that's a coping mode, a kind of bodyguard mode that protects the person. And we also know that there are other kinds of modes that are being protected by it. And so that brings us to another variation on this same mode language, where we can talk about two sides. You can talk about a side, for example, that's doing the protecting, the bodyguard or coping mode, and then you can talk also about the side that's being protected by it. And how would that go? Well, it might go something like this. Hey, I see today, as you're talking, I see, a side of you that seems kind of distant, or maybe is a little detached from your feelings. I just want to let you know that that's okay. I know that the side view is there for a reason. That maybe it helps you in some way. Maybe it protects you in some way. But I also just want to let you know that, I'm aware of the fact that, you also have another side. And, that's a side that, sometimes, maybe feels kind of alone and, might want to have a little bit of contact, might just want to pull the wall down just a little bit and let herself be seen. Okay, so here we use the same kind of intervention. I see a side view that, and then we describe the mode, the first mode, the mode that is present right now in the, right here in this very moment. And then we say, and yet I know that there's another side. And then you describe the second mode, that mode that is not at that moment in the person's awareness, but maybe we want to draw the person's attention to that mode as well, to help them to get more in touch with their vulnerability, for example. Okay. So again, just to emphasize, this is just a quite accepting and non-judgmental way of talking with patients about their different modes, and just remember that, there are reasons why people have their modes. And if you go, into, the session with the patient about their modes in this way, with some acceptance, then it's easier for them to accept their modes and to be able to talk with you about them. That doesn't always mean that we accept the patient's behavior. If patients are in modes and then those modes lead them to cross our boundaries, like, to behave in ways that are disrespectful to us, or threatening to us, or leaves us feeling unsafe, that's a different story. I mean, we can accept the fact that the person has their modes. These are parts of the person that they develop to protect themselves. And yet at that moment, when those modes are crossing our boundaries, we need to set limits with them. So in other words, there's a distinction between accepting somebody's modes and accepting their behavior. Okay. Now, again, this may seem quite new to you, this mode language, and maybe it seems a little awkward the first time you use it. So all I can say is just go out there and practice it. Just like any new language, it needs to be practiced. So, look for your opportunities. You can practice it with your patients, or maybe even first just practice it with some of your colleagues. If you're, let's say you're working on a ward and, you observe some modes and, you want to go back and talk with your colleagues about them, just start getting used to this phrase of, hey, I saw this patient's, mode, and I think it was a side of her that, and describe what you see. Okay. Now, today you learned how to talk the talk. You learned how to talk the mode language. But now the question is, what do you do when a patient's in a particular mode? You recognize the mode now. Now you have a way of talking with the patient about their mode. And how do you decide which interventions to use for which modes? And that brings us to our tip for next time, which is walk the walk. And finally, I wanted to invite you to our website, www.imodes.com, and take a look at our image-based therapy tools. Okay, see you next time.